There's a new Wall Street Journal interview with Donald Trump talking about his health. Let's talk about it. In it, he specifically states he takes 325 milligrams of aspirin for cardiovascular protection instead of what his doctor recommended, which is 81 milligrams. I think this is a little interesting snippet that's worth talking about in terms of why people won't listen to doctor's advice and just do their own thing. So, in this world, there's basically two types of people: people that understand evidence based medicine and people that don't. Now, this has nothing to do with Democrats, Republicans, conservative liberals. This is people all across the board. I see this all the time in my practice. People just don't really get evidence based medicine. And then people want to make their own decisions based on their limited knowledge of something, for example, using aspirin to quote unquote thin your blood. The current evidence states that for primary prevention of cardiovascular disease, the evidence is pretty weak, but 81 milligrams should be sufficient in certain subsets of population. But if thinning your blood helps prevent heart attack or stroke, why not just thin it more, which is what Donald Trump is thinning? So let's just take the full 325 milligrams, right? Well, the evidence doesn't support taking 325 milligrams, but still begs the question why people want to just do more. And that's because on paper, it sounds like doing more makes sense. If a little bit helps, a lot more will help, right? But that's not how evidence based clinical science works. Something may sound good in theory and on paper, but when you actually play it out in real life in a large scale clinical trial, the results might not be there. Not only might the results not be there, it might actually be harmful. In this case, higher doses of aspirin can lead to more stomach upset, can lead to more gastrointestinal bleeding. Of course, if you fall and injure or hurt yourself, you're likely to bleed that much more with 325 versus 81 milligrams. So not only is the evidence doesn't support it, it's also more dangerous to take the higher dose. But still, why do people want to take more when a little bit is enough? And there's this culture I think, in managing health where people think they have to do more even if the science doesn't support it. And I see this all the time. A great example is this obsession with testosterone replacement therapy. You have tons of patients with normal levels of testosterone who may not really have any significant symptoms, but the rationale is if testosterone makes me feel better, it makes me exercise more, why not take more even when the numbers are normal? Same thing with vitamins and supplements. If you're a pretty healthy person, have a balanced diet, are doing everything right, why not just take more? Because if a little bit is good, why not just take more? And that's what all of us in evidence-based medicine really try to teach and coach our patients is that just because it sounds good as an idea doesn't mean the science says it is actually helpful. Not only that, the science may suggest it's harmful, but it doesn't really matter. You can have very successful, intelligent, very well educated people who don't understand this basic concept that something has to be helpful, it has to be proven through a large randomized controlled trial. And in those same trials, we also have to show that a certain treatment is not harmful. But people continue to believe that their ideas, their theories based on the basic physiology, based on the basic understanding of something is that if this is a good idea in small amounts, if I do more, it'll be that much better. The other rationale that people use when trying to do more is that they haven't seen any harm. They've already been